On June 24, 1975, a young mother named Linda Harper was rushed to the emergency room with a fever that would not break, her abdomen swollen and throbbing, her life hanging by a thread, only to discover that the culprit was not a virus or a miscarriage, but a tiny plastic device that had been marketed as a miracle for women across the nation, the Dalkon Shield. In the weeks that followed, a cascade of similar stories emerged from hospitals, clinics, and homes, revealing a hidden epidemic that would claim the lives of at least 90 women, cause irreversible infertility in thousands, and forever change the landscape of medical device regulation. The Dalkon Shield was born in the early 1970s, a time when the United States was still reeling from the social revolutions of the previous decade. Birth control pills had already ignited debates over women's autonomy, and a new promise loomed on the horizon: a long-acting, hormone-free intrauterine device that could be inserted in a single visit and provide protection for up to 5 years. The device, designed by the A.H. Robbins Company, a pharmaceutical firm better known for its antibiotics, was marketed under the brand name Dalkon Shield. Its sleek, T-shaped frame seemed benign, but the true danger lay in its string, a multifibrous cord meant to guide physicians during removal. Robbins boasted that the Dalkon Shield was the safest, most effective contraceptive ever invented, and by 1974 the company had sold more than 1 million units, luring women with glossy advertisements that promised freedom from daily pills and the fear of unwanted pregnancies. Doctors, eager to offer a modern solution, embraced the device, and the FDA at the time classified it as a low-risk device, requiring only a notification rather than a full pre-market approval. The Shield's string, however, was a design flaw that would prove catastrophic. Its porous structure allowed bacteria from the vagina to ascend the cord, bypassing the uterus's natural defenses and traveling directly into the pelvic cavity. Within months of its widespread adoption, women began reporting severe pelvic infections, septic abortions, and unrelenting pain. By 1974, hospitals across the country were seeing a surge in cases of tubo-ovarian abscesses and peritonitis among Dalkon Shield users. Autopsy reports painted a grim picture: swollen, pus-filled fallopian tubes, necrotic ovarian tissue, and in many cases, bacterial colonies that had infiltrated the peritoneal cavity. The most common pathogens were anaerobic streptococci and gram-negative rods, organisms that would normally be contained by the cervix but were given a highway into the abdomen by the device's string. The medical community's first response was one of disbelief. The company's marketing materials had painted the Dalkon Shield as clinically proven, and physicians, many of whom had received lucrative incentives for each insertion, were reluctant to accept that a product they trusted could cause such devastation. It was not until a whistleblower from within Robbins, a senior engineer named James D. Hart, provided internal memos detailing concerns over the string's design that the narrative began to shift. Hart's documents, later revealed during litigation, showed that the company had known about the potential for bacterial migration but dismissed the risk, opting instead to downplay it in promotional literature. The legal battle that ensued would become one of the longest and most costly product liability cases in U.S. history. In 1975, a class action lawsuit was filed in New York, representing thousands of women who had suffered infections, infertility, or death. The case quickly expanded to include claims of wrongful death, loss of fertility, and emotional distress. During the trial, plaintiffs presented harrowing testimonies. A mother who had lost both of her children after a Dalkon Shield-induced infection, a teenager whose future was forever altered by irreversible tubal damage, and a widower who described the hollow grief of watching his wife die from sepsis that could have been prevented. The defense, meanwhile, argued that the infections were the result of poor insertion technique, pre-existing conditions or improper hygiene, attempting to shift blame away from the device itself. Yet, the weight of scientific evidence was undeniable. Independent studies, including a pivotal 1974 report published in the American Journal of Obstetrics and Gynecology, demonstrated a clear statistical correlation between Dalkon Shield use and pelvic inflammatory disease rates that were 3 to 4 times higher than those associated with other intrauterine devices. Autopsy findings reinforced these results, with pathologists documenting a distinctive pattern of infection that traced a direct path along the multifilament string. In May 1976, after mounting public pressure, media exposés, and the relentless advocacy of women's health groups, the FDA finally issued a recall of the Dalkon Shield. The company announced a voluntary withdrawal, but the damage was already done. By the time the recall took effect, more than 2 million shields had been implanted worldwide, and the human cost was staggering. Estimates placed the number of serious infections at over 30,000, with at least 90 confirmed deaths directly linked to the device. The economic fallout was equally severe. A.H. Robbins faced settlements exceeding $2.5 billion, a figure that would be adjusted for inflation to over $15 billion today, making it one of the largest medical device settlements of its era. The aftermath of the disaster reshaped the regulatory framework for medical devices in the United States. In 1976, Congress passed the Medical Device Amendments to the Federal Food, Drug, and Cosmetic Act, establishing a 3-tier classification system and granting the FDA authority to require pre-market approval for high-risk devices. Subscribe to the Autopsy Files for more stories like this.